Hey, my name is CJ. I'm going to be the nurse performing your musculoskeletal exam. Can you tell me your name and date of birth?
Magnolia Baxter in 04/03/2002.
Awesome. So the first thing I'm going to do, perform hand hygiene. But we'll go over some of the key terms I'm going to use within this video. So we'll go over some muscle movements. So we'll go over, this is flexion, when you're moving your arm up and towards the body. Extension is moving your arm away from the body. And then you also have pronation and then supination. I always still like to say, like, oh, you're holding a bowl of soup. So in order to get your soup, you do supination. And then you also have circumflexion, which is all the way around like you're throwing a softball. And then you'll go to your ankle, you have extension, which is your, or inversion, which your toe is pointed in towards your body. And then eversion, you move your foot away from your body, out and away. And then you also have depression, where you move your shoulders down, and elevation, where you move your shoulders up. So those are some of the key terms I'm going to use when assessing her joints and muscles. For muscles, we use a grading system from 0 all the way to 5. So 0 is going to be, there's going to be no contracture. They're completely limp. There's no sort of muscle movement at all. You're going to see a lot of this with people that are paralyzed. They'll have no sort of, no contracture of the muscle at all. 1, there can be a slight contracture. You might feel the muscle just move a little bit. 2 is like your passive range of motion. You're able to move the arm around or move the limb around passively. Then you have 3, which is where they can move their limbs against with gravity. 4 is they can move their limbs against gravity as well as some resistance. And then 5, which is our standard, they can move their limbs against gravity plus full resistance. So those are some of the grading skills I'm going to be using. First, I'll have Magnolia stand up. We're going to assess her balance, her gait. So I'm going to have you stand over here, and you're just going to walk normally across the camera. Good. And then I'll have you walk back. Good. And then walk heel to toe. Good. So here we're just testing her cerebellar function. You do this in a neurological exam often, so you don't have to do as much with the musculoskeletal, but it's always a good thing to assess her gait, her function, her balance. You can also have her stand and then close her eyes, see if she can still balance. And now I'm going to just touch you, so try to keep your balance. Good. So her neurological function is intact, her cerebellar function is intact. Next, while she's still standing, I'll have her turn around, and we're just going to look at her spine. We're going to see, it looks like her shoulders are symmetrical. Some people with scoliosis will have one shoulder higher than the other. Same with her hips. Her hips are level as well. And it can also go down to her knees. You can see that her knees are level as well. Again, with people with scoliosis or other sort of back dysfunction, you'll see it being asymmetrical. Hers looks really symmetrical. And then we're going to palpate it. You're going to find C7. C7 is right here. You'll find this, it's one of the big lumps or knots right at the top. So then we're just going to go down. And then you're just going to tell me if you feel any pain, tenderness, or swelling.
Nope.
No pain? Good. No tenderness. I don't feel any masses or lesions. Her skin looks intact. I don't see any scars that could show me that maybe she had back surgery. And then next, I'm going to have her slowly bend over. And you're just going to keep following that along while she bends. Good. And you're going to just look for the straightness in her back. And it's pretty straight. I don't see any curvature. You can also tell by her hips are level and symmetrical. And you're good, you can stand up. Back's all good. Then I'll have her sit back down. And then I like to go from head to toe. So I'll start with her neck. So if you can move your neck to your ear and then rotate it all the way around. Any pain or discomfort with that?
No.
Yeah. And it looks symmetrical, as you could see that when she rotated, it looked the same on both sides. Some people with neck pain, or if you wake up with like a neck soreness, they're not going to be able to move their neck all the way around. Then I'm going to have you move your neck against resistance. So turn into me, good, turn into me, move your head down, move your head down, move your head up, and move your head down. So there, she was able to move her head against full resistance. So therefore, her neck muscles are at a 5. Next, I'm going to do her shoulders. So you're just going to touch, palpate, inspect. There's no masses, lesions. The muscles look the same on each side. There's no pain or tenderness. No pain, right? Good. I don't feel any lesions, no redness, swelling. A lot of people have rotator cuff injuries. Some people that play like sports like volleyball, baseball, even football for quarterbacks that are throwing, they'll have increased muscle mass on their more dominant side. But hers looks really symmetrical. Then we're going to move her shoulders against resistance, so move up, good. And then move your shoulders back, move them forward, good. And no pain or tenderness with that?
No.
All right, and then I'm also going to have you stand up so you don't hit the wall, but move your arm in a full range of motion, good. And now to the other side, good. Now do this arm, good. As you can see, she's able to fully go around and back, good. No pain or tenderness.
No.
And then I'm going to have you turn around, and you're going to move, yep. And as you can see, she's got really good stretching. What's that word? Flexibility. So she's able to even touch her fingers to her arm. And as you can see, there's no pain, no tenderness. She's able to do it. And now switch arms. So some people may have a slight decrease in flexibility depending on the shoulder, and that's completely normal within her limits. Hers, she has pretty equal flexibility on both sides of the shoulder. All right, sit back down. And then I'm gonna look at your fingers. As you can see, beautiful nails. And then we're just gonna like palpate each of the joints. Good. Any pain, tenderness, swelling?
No.
Those that have like rheumatoid arthritis or like arthritis in their fingers, they'll have their nodules will be bigger on their fingers here. And then you'll see pain, tenderness, and swelling associated with that. You can also check cap refill, make sure fingers are being perfused, always helps. Then we'll go to the other side, check again, look for symmetry. Fingers look symmetrical. Then I'll have you move your fingers down, move your fingers up, move your fingers out, move your fingers in, good. And then also test against resistance, good, and up, good. The other side, good, and up, and then in and out. So, pretty symmetrical there. 5+. Then we'll check the wrists, inspect. I don't see any deformities. You can see the tuber holes here on the side, the bones that stick out. That's completely normal. And then I'll rotate in. You can even check for a pulse while you're here. Okay. Again, both her wrists look symmetrical. No lesions or masses, no redness or swelling. Any tenderness? Good. And then I'll have you pronation, supination. There you go. So she's got full range of motion. Any pain or tenderness with that? Great. Now we'll go to the elbow. We'll just look. Good. seeing no pain, tenderness. You can see that she can kind of hyperextend her elbow here. Again, those are normal in some people as long as there's no pain associated with that. Good. There's no tenderness or swelling.
Nope.
Good. And now touch. Good. Feel symmetrical. Even. No swelling. And then I'll have you on this arm. Okay, then raise. And then you also want to try to feel the bicep too. Make sure it's being contracted, and it is. Good. It's symmetrical. And then I'm also going to have you here and then both. Good. And yeah, strength was symmetrical, both sides. 5. Triceps and biceps. Next, we're going to move to the hips. So I'll have you stand up. We'll inspect. We did inspect when we did the spine. Oops, I need to get the camera frame. As you can see, yeah, symmetrical. And then we'll just palpate any pain, tenderness, swelling. Good. Then I'll have you bring your knee up. Good. Bring your other knee up. Bring your leg back. Bring your other leg back. Good. And then I'll have you turn this way and do a leg swing. Good. And other side. Good. So full range of motion. I'll have you sit down now. We'll test the strength. Move your leg up. Move your other leg up. Good. And then move your leg back. Good. Move your leg back. Good. So quads, 5+, and hamstrings as well were 5. Then we're gonna look at the knees. So without just sitting here, as you can see, they're 90 degrees. There's no pain, tenderness, swelling. Good. And then I'll have you stand up, and I'll have you turn around. And we're just gonna turn towards the camera. Good. We're just gonna palpate the back too. Any pain or tenderness back here?
No.
Good. All right. And then if you can turn that way, move your leg back. Good. Back. Also hit a squat. Good. No pain, tenderness. We did flexion and extension. As you can see, when she flexed her knees, they went out. And when she moved back up, they extended. And there was no pain associated with that. All right. You can sit back down. We'll do ankles. So first, going to look down here in the ankles. You really want to check for edema. So when patients have swelling, their ankles are going to be one of the first places to show swelling. Oh. So you want to check for pitting edema. As you can see, no pitting edema. Ankles look symmetrical. Any pain or tenderness associated with any of the spots I'm touching?
No.
Good. Okay, and then I'm going to have you dorsiflex, move your foot up. Good. Dorsiflex, move your foot up. Good. Gas pedal, move your foot down. Gas pedal, move your foot down. Good. Strength was equal bilaterally, 5. And then we're also going to check her toes. So again, you're going to check it for edema. Toes will also swell. You also want to check, like when patients that have diabetes, they'll have sores and stuff on their feet. So you really want to make sure you check, make sure they have all their toes. And then you're just going to palpate each of the joints. Any pain or tenderness? Good. And then I'm going to have you scrunch your toes up. Good. And then extend them, fan them out. Good. So she's got full range of motion in her toes as well. All right. And that concludes the musculoskeletal exam. Thank you guys.